the most funny experiment in the whole history. They proved that we can breathe through our butts. And this experiment achieved Nobel Prize in 2024. Furthermore, this method can be used for medical treatment. When mouth and nose are stuffed, we can see oxygen gel and pump inside of the disaster kits in the future. They managed experiments on animals, but now they are looking for human volunteers to proceed this application. Where did this idea even come from? How does oxygen get in from there? How the hell they proved that? I will explain it in a way everyone can understand in this video. Inspiration and previous scientific observations. Where did this idea even come from? What is the original story? It starts with animals. It is found that in 1950s, some species can breathe throughout their posterior intestine in low oxygen. The others asked based on that species if their guts can exchange gas. Could mammals do a tiny version of that in an emergency? The rectum wall is thin and full of tiny blood vessels. That's why suppository works fast. The drugs go straight into the blood. So the idea is, if medicine can pass there, maybe a little oxygen can pass too. The logic is simple. The walls are very thin and work well for absorbing drugs, so oxygen could pass through the wall and mix with the blood. As a result, we could breathe through our butts. Theoretically, yes, it can pass, but it needs to be tested. Okay, it can theoretically pass, but how can we give oxygen to body? Gas, liquid, or another option? How will oxygen get there? Researchers first thought about using gas. Yes, you can give your rectum oxygen in gas form, but if we give oxygen as gas to the rectum, can it be dangerous? Is there any risk? Yes, there are many risks. If you pump oxygen, the rectum can overswell like a balloon, and this can cause micro tears in the organ. They already tested this method with mice and without any additional steps. The gas-only result was not effective, but when they thinned the inner lining, mucosa, it became more effective, though there was a still risk of irritation and bleeding. Another issue is that controlling the pressure is difficult. If you lose control even slightly, it can harm the body. They also tried this with pigs, but it didn't work because pig's inner lining, mucosa, was thicker, which prevented oxygen from being absorbed through the rectum. As a result, giving oxygen as a gas for treatment is not a good option due to low safety. Then they thought, how can we inject oxygen? Maybe it could be in liquid form. First, they selected the right liquid, one with a high capacity for holding oxygen called perfluorocarbon. Then they filled the liquid with pure oxygen gas until it was saturated, like a sponge completely soaked with oxygen. If we imagine it, we now have an oxygen sponge that can be absorbed by the rectum. In application, they gently delivered this oxygen-rich liquid into the animal's rectum using low pressure. Theoretically, it should work because it contains oxygen and rectum can absorb it easily. The liquid coats the inner lining of intestine and oxygen then passes through this thin wall into the blood. This method has several advantages. No need for high pressure, so less risk of tearing or overinflating. No need to damage or thin the intestinal lining. Oxygen transfer is more stable and continuous. They named this method LEVA, liquid enteral ventilation via anus. The results were positive in pigs and mice. The liquid increased oxygen levels and caused no major side effects. Researchers believe it has potential as an extra oxygen delivery route in cases of human respiratory failure, but clinical trials are still needed. In fact, they have already started phase 1 clinical trials in humans and are seeking volunteers. This means that one day we might see oxygen liquid gels included in disaster kits for breathing emergencies. When we talk about enteral ventilation via anus or EVA, we are not only talking about medical science, we are also talking about the ethics and society. First, there is the issue of privacy and dignity. Even if this method can save lives, many people will feel embarrassed or uncomfortable with this idea. Cultural attitudes are different around the world. In some cultures, anything involving the rectum is private or even taboo. This can make people hesitate to accept the procedure, even in life-threatening situations. In some places, it may be accepted faster. In others, there may be a strong resistance. We have public perception, Right now, most people will first laugh when they hear breathing through your butt. That's natural, but then we must explain the science, show the benefits, and change the conversation from a joke to real-life saving option. Portable EVA device idea. If EVA technology is going to be used outside the hospital, we need to think about making it portable. A portable EVA device could give oxygen quickly in places where normal equipment is not available. One idea is to have a small oxygen gel pack that holds oxygen in safe form, together with a low pressure pump. The gel could be pre-filled with oxygen, ready for use, and the pump would deliver it gently into the rectum without damaging the lining. The device should be easy to carry, small enough to fit in a rescue kit or even in a backpack. It should also be single-use and sterile to prevent infection. Who would carry it? Probably paramedics, firefighters, mountain rescue teams, or disaster response units. In the future, it could even be part of the disaster kits in schools, stadiums, or airplanes, next to first aid kits and fire extinguishers. To make this possible, engineers would need to design pressure control systems so the oxygen delivery is safe, and clear instructions so trained users can apply it quickly. If developed well, a portable EVA device could give a few extra minutes of oxygen in emergencies, enough time to reach hospital care and possibly save lives. We talked about the benefits of EVA application but didn't about risks and limitations. So what are the risks? While EVA, especially the liquid version, has shown promising results in animal studies, there are still important limitations and risks to consider before it can be widely used in humans. One limitation is duration. The oxygen inside the liquid does not last forever. Once it is used up, the effect stops, so the liquid needs to be replaced or refreshed. This makes EVA a short-term solution, not a full replacement for normal breathing. Another concern is infection risk. Rectum is full of bacteria, and introducing liquid or gas can increase the chance of infection if the procedure is not completely sterile. There is also danger of pressure-related injuries. If too much gas or liquid is delivered too quickly, the intestine can swell like a balloon, which may cause micro-tears or, in severe cases, perforation. Some people may also experience irritation or inflammation of the intestinal lining, especially if the procedure is repeated or done incorrectly. Finally, there are acceptance issues. Even if it works, some patients may refuse it because they feel uncomfortable or embarrassed about the methods. For these reasons, EVA should be seen as a temporary, last resort option for emergencies until more research is done and safer, more user-friendly systems are developed. EVA is still in the early stage of development, and there are many areas for future research before it can become a common medical tool. One focus is improving the oxygen carrying liquid. Researchers could develop new formulas that hold more oxygen, stay in the body longer, and cause less irritation. This could make the method more efficient and safer. Another direction is better delivery devices. Future EVA systems could have automatic pressure and flow controls, built-in safety sensors, and faster application methods so that even non-expert can use them in emergencies after minimal training. Another direction is better delivery devices. Future EVA systems could have automatic pressure and flow controls, built-in safety sensors, and faster application methods so that even non-experts can use them in emergencies after minimal training. Clinical research will also be important. While current results are from animal studies, the next step is to complete human clinical trials. This will help understand how the method works in people, what the real risks, and which patient groups would benefit the most. Researchers might also explore special uses. For example, high altitude climbing, diving, or space missions where oxygen supply can be a challenge. In the long term, EVA could become part of standard emergency kits, but only if these improvements are made and public trust is built through clear communication and successful trials.